obviously these conversations really help with that, because they're all different but similar. you know,
there definitely is a spoiler alert for them. There is a lot of determination. There is curiosity, questioning. Going into different modalities and exploring different things, and then getting curious about the curiosity.
And strength, and not in the way of like pushing or forcing through, but even though when we've been at our lowest, finding that edge that says, yeah, okay, no, I'm just going to take a step back for now and see it slightly differently. So yeah, maybe, you know, it's a different way to look at your health. That's maybe how we should define it really quickly. A different way to look at the journey that you're now on, so that you can experience it a little bit. I don't know, just more wide ranging.
Yeah, wide ranging, but I think it's not about doing more. Quite often it's about doing less. What can you take away? What can you let go of? And that might be beliefs, it might be habits. And clearing space, because we can't see the wood for the trees, right? So it's how do we get to take that step back and be honest with ourselves and get back into that point of trust. Trust in ourselves. Like you always have that little, when somebody says something to you and you know it's not true, you feel it physically in your body. We were trained from a very young age to disconnect from that. When we started at nursery or at school, you were taught how to behave, when to eat, when to drink, when to sleep, all the rest of these things, rather than being able to tune into your own body. So if we can start to unlearn these things, to hear the knowledge and wisdom of your own body.
I think the message from what I've heard as well, mostly within this lived experience realm, is that the practitioners that have got lived experience, even with the GP that we spoke to, was like, it allows us to see things differently, because we kind of know what it's like in some ways to be where you are, or we don't know your exact journey or where you're exactly at or what you're experiencing, but we can sit with you in that. And that's something that maybe that hierarchical approach has never allowed before. And, you know, to me, with my clients, it's not that I'm a way off and I know all the answers. I'm still learning about my own health too. It's just that the bits that you need to know, I've already been there. So it's kind of getting you over those points where you might be stuck right now. And by the time you get to here, I've gone a little bit further. So, you know, it's just that way. I mean, I was 17 when I was diagnosed, so it's been a long time of learning, and I literally needed this kind of support when I was there, and it just wasn't there.
Didn't exist.
No, it didn't exist. No.
Do you want to talk a little bit about your journey?
I can do. What would you like to know about my journey?
What happened at 17?
So at 17, I was away with a boyfriend, an ex-boyfriend in Cambridge. Just had a normal night, and I started to watch the telly in the evening. I was like, my eyes really sore, and so we just switched it off, went to bed really early, and then I woke up the next day and I couldn't look at light. The curtains were closed, I had sunglasses on, and still I had pain. And so his mum was actually a nurse, and he was like, what does she need? And she was like, I don't know. It sounds like, painkillers, whatever you need to get. So I went home on the Monday. I went to see the GP, who gave me some little drops and said, try it, but I'm going to actually speak to the hospital because I think I know what this is. I was still in a lot of pain, and I went to the emergency ophthalmology clinic the next day, and they kindly said, an old consultant that looked me in the eye at 17 and said, yeah, this might come back, it might not, but we think it's what they call an autoimmune disease. So your body's attacking itself, and you might get it back, you might not, but probably you've got this for life, and this is just who you are now. And I was on my own, 17. I'm not sure if I can even connect to that moment when I was like, what do you mean? This isn't just something that can be like fixed, the drops worked miraculously. And so I just thought, well, I hope it doesn't come back, and just kept going. My lifestyle didn't change. I still was working. I was apprentice in a hairdresser's. My smoking and drinking carried on, my poor sleep, my bad eating, all of that, it just carried on until it started to really come back. all the time. Not so much then, but in my 20s, it came along and bit me on the arse as I moved out with a new partner at the time in my 20s, and it started to come back because I obviously hadn't stopped smoking.